Okay guys, welcome back to my channel. I am in full hair, full makeup, feeling myself today, except for this one little frizzy curl that's like acting stupid, but it's fine, we'll ignore it. But today is the day everybody's been waiting for, me talking about how fundamentals went. So as you can see, I'm currently in my office. I'm standing up. My chair's behind me. I got some water and some donuts in case I get hungry, because I haven't eaten breakfast yet this morning. I just got up and kind of picked up the house and did my hair and my makeup, made myself a cup of coffee, and yeah, so that's all I've done this morning. And I figured I have full hair and makeup, might as well utilize it and make a YouTube video. So anyways, today what we are talking about, I don't know if that fan's loud. There's no AC in my office, so I have to keep the door open for it to be like cool in here. So I have this open with the fan blowing here to get the AC in here to kind of like cool it off, and I'll close it in a minute so it sounds better. So I'm sure you can probably hear the wind, but if you knew how hot it was in here, you would understand. I'm gonna kick my shoes off too. Alright, so today we are talking about fundamentals of nursing. My first nursing class in nursing school, how it went, what we learned, what books we used, what we didn't use, just all that kind of stuff. It's just going to be a complete rundown of fundamentals of nursing. So my book came like to where you have to put it in a binder. It didn't come in like a sleeve, so you had to put it in a binder. I personally hate that. I don't like it. I feel like I'm paying so much money for a textbook. I should get a book that comes not like this to where my pages are about. But anyway, this is the textbook that I use. It's Fundamentals of Nursing, the 9th edition. It's from Elsevier, and Perry and Potter wrote it. And Stockter and Hall, I guess. Anyways, but this is the book that we used. So I'll be talking about kind of like the assignments that we went over, stuff like that. We also used my ATI which I don't know where it is right now. Here it is. My ATI fundamentals book. We also used this book. So these are the two books that we used mostly for our class. I mean, we were required, our books came in like a pack, so we were required to get the book that came with like the nursing drug guide, the diagnostic and laboratory test reference, and I think that's all that it came with. So that came with our kit. I also had the study guide for my fundamentals textbook. I personally used it at first, but then didn't feel like it helped me very much, so I stopped using it. Oh my god, this curl is just like messing up my video. Anyways, but I at first used the study guide and then found that it didn't really help me, so I didn't really like it, so I stopped using it. But and then I have my lab bag. I did a lab bag video, so everybody, if you haven't seen that video, go watch that video, and it's all about what's in my lab bag. Okay, so that's all the stuff that we used, and plus obviously our things for lab, like my stethoscope, trauma shears, pen light, my student ID badge, pulse oximeter, blood pressure cuff, like all those kind of things that you obviously have to have for lab and clinical and stuff like that. Okay, but let's get down to the nitty-gritty. Alright, today is Saturday, May 18th. My semester ended, I want to say on the 29th. I went in and took my final, and that was my last day, and grades posted on May 1st. Since the semester has ended, I've just been going to the beach and relaxing and just really trying to enjoy summer, because next summer I won't have off, and I've been going to school for like 2 years straight, so this is the first semester that I've had off in a really long time. So I'm just trying to enjoy it. So that's why it took so long for this video to come up, is just because I just needed to decompress. I needed like time for me to just get my head together and like be like, okay, like the semester's over, time to reboot and, you know, get ready for the next semester. But anyways, now this is my iPad. It has my syllabus on it. I have my paper syllabus, but it's just kind of a hassle to mess with all the papers, so I'm just gonna pull it up on my iPad. And I probably should put down my coffee so you can see it. I currently use Notability and GoodNotes. I use both of them. They're both really good at taking, oh, you're gonna see my natural light going on. Anyways, so let's just skip that. But so I have my syllabus on here. That's a video for another thing, my note-taking apps. But I have my syllabus in Notability, and it is the longest syllabus I've ever had, ever. And like any class I've ever taken, it was like 37 pages or something crazy like that. So anyways, all right, let me sit down. Let me sit down and explain this and how this went. Okay, so fundamentals, this is how they broke down like the grading scheme. So we had, I want to say 12 exams, like regular exams, and then a final, I'm pretty sure. But our exams were 55% of our final grade. Our homework, ATI assignments, SurePath, all that stuff was 20% of our grade, our final grade. We had a 8-page research paper that we had to write. That was 5% of our final grade. We had a final exam that was comprehensive. That was 20% of our final grade. So that makes up the 100% of the final grade. So the one thing about this class that I did notice is like your homework and all that kind of stuff really doesn't do anything for you. Like, I think I had an 84 in the class with my exams overall before she added my homework, and it only went up to an 87. So all your homework and stuff, they just really don't do much for you. It's hot, I have to open this. But so pretty much you have to, like, going into, like, for me anyways, going into my nursing classes, I had to realize that I've always made good grades on my exams, but there was always stuff to like balance it out, like other assignments or, you know, a paper or, you know, participation. Like there's usually other things that they add into the grade that, you know, help your grade be better. But in this class, I feel like, you know, the weight of the exams was so heavy that you really didn't have much wiggle room with your exams. You really had to make a grade on your exams, and whatever your overall exams were was kind of what your grade was going to be in the class. Like, I was hoping that, you know, the paper and the homeworks and all that stuff could have bumped me from the 84 into like the 90, so I could have got an A, but I soon realized that that was not the case. So that kind of, that sucks. That sucks that you have so many assignments and so much work and they really don't count towards anything. Like, I want to say like when she put my medication calculation exam in there, it like moved my exam, my grade like 0.1%. I mean, just like so much work that you have to do, and it just really, it really doesn't matter. It's a lot of busy work. I mean, it's good. It helps you learn and stuff like that, but towards your grade, it doesn't do anything. So that sucks. So pretty much, fundamentals was your grade is all test-based. So if you're not good at test taking, you better learn how to start being good at test taking, because that is where your grade is going to come from. So in the beginning of the class, I was having a hard time figuring out, you know, how I should study and if I should read the whole chapters, and it was just like, it was a really hard learning curve for me because it was just so different from all the other classes that you take. And you know, everybody says that, but it's just so true. Like the NCLEX style questions are so hard. Like learning and thinking like that is just, it's on another level. Critical thinking is just, you know, you think that you're a good thinker until you get into nursing school and you realize that you really have to like analyze and get in depth with, you know, what they're really asking you and stuff like that. But anyways, so let's move along from that. So that was the grading thing. And so our semester was 16 weeks. Our textbook was 50 chapters. We read every single one of the 50 chapters in the 16 weeks. We usually had anywhere from 2 to 6 chapters in our fundamentals textbook every week. We usually had anywhere from 2 to 4 to 6 chapters in our ATI book every week that you're required to read and do the end of the chapter questions, and then go online and do your ATI assignments, and do your SurePath assignments, which is like online stuff for your textbook. So it was just a lot of stuff every single week. But anyway, so in the class we learned a lot. I think that fundamentals, I don't know, me personally, I feel like this is my first nursing class, so I'll see how I feel as I get through the program, but I feel like it is one of the harder classes because it is such a learning curve. Like, you're completely changing the way that you study, learn, think. Like, everything is adjusting and changing to this new way of thinking and like looking at situations and stuff like that. So I feel like fundamentals is a difficult class. I feel like it's underestimated. I know I definitely underestimated fundamentals. So just keep that in mind. But in fundamentals, we learned about nursing diagnosis, we learned about the nursing process, we learned about basic nursing care, like CNA type work, like bed baths and showering, toileting, ambulating. We learned how to insert urinary catheters. That's my grandma. Don't mind her walking around. We learned how to insert urinary catheters. We learned how to do, obviously, vitals, a physical assessment, a head-to-toe physical assessment. We learned a little bit about a medication administration. We had a medication administration exam that was more about like dosages than it was about the actual medications. But yeah, so we learned quite a bit in fundamentals. Like, I feel like I learned a lot. This is my textbook because, like I said, remember, it came in a binder, so this monster is my textbook. And so these are all notes that I have, but so as you can see, that's that. But like, I organized it, like all of these, all right, let me close it. All of these are like by the week. So like week 1, week 2, week 3, week 4. So because every week we had an exam. So and the chapters don't go in order. They're like mixed up every week. So every week I would pull the chapters out of the textbook and organize it by the weeks. So that way when I got to the end and it was time to do the final, I would just already have this how it needed to be so I could study. So I broke it up by the weeks, and then within the weeks it's what do you call it? It's each week's chapter. Like week 1 had, you know, chapter 1, 2, 3, and 4. Week 2 had chapter 45 and 46. You know what I mean? So I organized mine like that. That way it was a lot easier when it came to the end of the semester to be able to study for my final. I will say that I put all my notes, my study guides, filled out, like everything. Like I organized like every single week, everything that I did. I just took that out of my smaller binder and put it into that big binder and just made it organized through the whole semester of everything, like how we learned it, the way we learned it, and the order we learned it in. And I feel like that really helped me to stay organized. So I definitely recommend that. And I definitely recommend that all the chapters, because there's a lot of practice questions at the end of these chapters, make sure you do those and make sure you're reading the rationales and really trying to understand like why the answer is the answer. Why is that answer the most right compared to the other ones, you know? They have case studies that you can print out. They have like an online adaptive quizzing thing that you can do practice questions, and I did hundreds of them every week. I mean hundreds. Every single week I was doing the Elsevier online. Like, this is the link to it right here. It comes, usually you have access with your textbook when you buy it, as long as you buy it from your school and you didn't like get it used or something. But I did the practice questions online every week, and you know, at first I struggled a little bit, but I feel like as the semester went on, it got easier. And you know, I got an 88.5 on my final, and I really didn't study for it, so I feel like by the time I got to the end of the semester, everything I needed to know I had learned, and felt pretty confident with. I think it was just a struggle of getting the information in the way that they want you to, because like I said, the NCLEX style questions and learning is it's different, so it's a little bit of a learning curve. But I feel like I ended fundamentals in a really good place, and I'm ready to go on to medical surgical nursing 1 in pharmacology. So I'm excited about that. But anyway, so this is my textbook, and this is the study guide that I got with it. It was like 40 bucks on Amazon. And then this is my ATI book. That was my husband's PS4 controller. Whoops. This is my ATI fundamentals book, and I really like this book because the chapters are like condensed. Like, they're a lot shorter. Like, I would go through and like highlight, I don't know if you can see, focus. I would like highlight stuff that was important to me, and I would like answer, let's see if I can find I would answer the end of the chapter questions. And I feel like these are really good. Like, it has like diagrams and everything for you. But the thing that I liked about the ATI books is, see, like, here's the end of the chapter questions, and I would like put a little highlight mark. I don't know if you can see my little highlight mark. I would put a little highlight mark next to like whatever the right answer was, so that way, like, you know, when I would go back through like and read it to practice, like, I knew like, okay, that was the answer and stuff like that. But I like the ATI book because it's the same information as your textbook. It's just like condensed, and it's a lot less like reading. So if, you know, you didn't have time to read the whole chapter before you went to lecture or something like that, like, you can read this real quick and, you know, kind of have like a roundabout of what is going on in class and what they're going to be going over and stuff like that, to be more prepared, so you don't look like an idiot if, you know, a question's asked or something like that. So this is really good because the chapters are like condensed, and I like it because I feel like there's not so much fluff in it. Like, I feel like the textbook had so much just bullshit. Like, it said the same shit over and over and over again. I mean, excuse my language, I don't know. This is YouTube, I don't know how the cussing thing works, but there's just so much extra stuff that's unnecessary that you really don't need. Like, I feel like some of the chapters, it was literally like reading the same chapter over and over again. I don't know. There was a lot of bullshit in the textbook, whereas in this is like cut and dry, straight to the information, no fluff, no extra, like just what you need to know. So I really like that about our ATI book. So that's what we used for that. But anyway, so that material was what we used just for our exams. Then we had our lab stuff, which obviously your lab stuff usually kind of correlated with whatever you were learning about in lecture, but it was a little bit different, and we didn't have a textbook or anything for lab or clinical. It was just kind of like you showed up and we learned whatever we learned that day, and we had a paper that like we checked off as we went through. But I just want to go over like the first thing that we learned in like lab and clinical was obviously the basics, like how to use your stethoscope was the first thing, like what your stethoscope, I'm gonna make a how to use a stethoscope video, so I'm not gonna get into it, but like what is the parts of the stethoscope, how to use it, that kind of stuff. You know, we learned about trauma shears and why you need them, and you know, a pen light, you know, pulse ox. I got this one on Amazon just because I thought it would be good to have. Blood pressure. You gotta have a blood pressure cuff so you can take a blood pressure. It's called like a spigometer or some crazy name. But learn how to take a blood pressure. Like, all that's really important. we learned how to do transferring, bed baths, toileting, ambulating, feeding, partial bed baths, mouth care, foot care, showering. I mean, we just learned so much for basic care. And we were in like a rehab slash like assisted living facility, so there were a lot of older people who were, you know, at the end of their lives and needed a lot of extra care. And then there was people who had like broken a hip or something like that and were like recovering and trying to get home. So it was a crazy experience, man. Like, I just feel like I learned so much. Like, that was my first medical experience. I have no prior medical background before going into nursing school. I cleaned houses, I waited tables, I worked at the dollar store. I mean, like, I just had like normal little jobs. I never really had a medical job or anything like that. So this has been my first experience. So I feel like I really like dove in head first, and I just learned a lot this semester. But anyway, so you have to learn like your basic vitals. So temperature, pain, blood pressure, pulse, respirations. Am I forgetting something? Am I forgetting something? BP, pulse, respirations, temperature, pain. Yeah, I think that's it. Can you tell I've been off for a while? Anyways, but so you have to learn your basic vitals. You have to learn all of the basic care like that, you know, you do in like an assisted living CNA type work. And then after you do all that basic stuff, then you move into doing like urine input and output, and then like stool, like passing stool and making bowel movements and bowel patterns and all that kind of stuff. So then you go into enemas and catheters. So I don't have an enema, that didn't come in my kit, but I do have a catheter kit. So I'm just going to show it real quick because it was part of my fundamentals class. I had a skills checkoff for it, I had to do it. So and I'm not going to do the sterile technique and all that right now, so I'm just going to show, like, this is the catheter kit. You open it and you have your gloves, you have 2 drapes, you open it, you have a specimen container. This was lube, it's used because I used it for my checkoff. So you have your specimen container, you have lube, you have the swabs to clean, you have your saline water to blow up the catheter balloon, and then you have your Foley catheter kit where you have the urine catch bag and then the actual catheter. And this is a physical checkoff for fundamentals of nursing. At least it was for my school. I'm in a ADN RN nursing program, so I can't speak for other schools, but I can speak for my school, and we had to do that in fundamentals, and we learned how to do enemas also. So then after we did that, then we moved on to just like learning about like charting and stuff like that, and just kind of, we followed the CNAs for a long time, and then after we did the catheter, we kind of like adjusted into following the nurses, which then at that point is when we started learning about medications, medication administration, the 6 rights, like all that kind of stuff. And all the stuff I'm just like saying off memory, so like if I say like, if I forgot like one thing or all that stuff, like I only took fundamentals and I've been on break for a while, so cut me some slack, don't attack me if, you know, I don't get everything perfectly right. I mean, I am human. But anyways, so then we moved on to the physical assessment, and the head to toe physical assessment is obviously, you know, you're just doing a physical assessment on a patient. You're going to check their neuro status, their cardiac status, respiratory status, musculoskeletal status, their integument, their GI system, their GU, just kind of do a full assessment on your patient, see what they have going on, get a medical history on them, all that kind of stuff, just to see how your patient is at, where they're standing as far as like, are they stable, are they unstable, or, you know, what's going on with your patient. That is what a physical assessment is to do, is to give you like, okay, this is my baseline and I'm going to move on from here to be able to take care of this patient. And so the last few weeks of the semester was pretty much just that, because that was really important. So we did that for a long time. We did it in clinical, we did it in lab, we did it in lecture, and I feel pretty confident with my physical assessment. And next semester we start in the hospital, so I'm sure that we'll get to actually start doing it in the hospital. I mean, we got to watch physical assessments in clinical, and we had to do a physical assessment check off on a mannequin in lab, but I haven't got to do it like by myself on a real patient yet. So I'm really excited to do that. But yeah, so that's pretty much all of the stuff that we went over in fundamentals. Fundamentals is a theories class, so you learn a little bit of like hands-on skills and like how to take care of patients and stuff like that. But I feel like a lot of it is theory and learning like the history and the background of nursing and like why nurses do what they do, the nursing process, ADPI, you know, learning about HIPAA, learning about infection control, sterile technique, hand hygiene, PPE equipment. I mean, you just learn about so much stuff. I mean, if I literally went over every single thing that we learned about, this video would be forever long. It's already super long right now. But yeah, it was a really great experience. I really enjoyed it. I learned so much. Like, I feel like I really helped people, and I love it. Like, I can't see myself doing anything else anymore now. Like, it's really just, I think it's found like a place in my heart. I don't know, it's so weird. Like, I was always so afraid of nursing, and it was such a big commitment, and I knew I wanted to do it, but I didn't know if I'd be good at it and all this stuff, because I had no prior medical experience. And you know, now just like wrapping up this first semester and clinical and all that kind of stuff, and just realizing that, you know, like, this is for me, and I am smart enough, and I can do this, and I'm gonna have to bust ass, and it's gonna be hard, but if it wasn't hard, then everybody would do it. So, you know, I just feel so blessed to be in this position, and you know, I can't wait to document the rest of my journey and all that kind of stuff. But I have more videos coming. I'm gonna make a video on how to use your stethoscope, what is the stethoscope, like what are the parts of the stethoscope, like that. And I'm off until August, so I have like tons of time to make these videos, so you can anticipate a lot more from me. And if you have like any questions, like if you want me to like go in depth with like the physical assessment or like the nursing process, or like you have questions about like the ATI medication calculation exam, like anything like that, feel free to comment, message me. Make sure to follow me on Instagram, because I do like a day in the life. I like to, you know, keep with what's going on in my life day to day on there. But yeah, feel free to contact me and ask me any questions or request any videos. And yeah, so I've enjoyed making this video. It's super long and I have stuff everywhere, but it's fine. I'm gonna clean everything up and put it away, and then I'll make a video within like the next week or two on how to use your stethoscope, and maybe I'll make like a how I studied for fundamentals video and stuff like that. This is just an overall of like what happened, how it went, like, you know, just like an update of it. I enjoyed it. I learned a lot. It was a little bit of a learning curve, but it was good, and I feel like I'm in a good place and I'm ready to move on. So I hope you guys enjoyed this video, and I will see y'all in the next video. I hope you guys have a wonderful day, and I made it through fundamentals, so it's on to med-surg 1 and pharmacology. So that should be exciting. And honestly, really been enjoying just like making these videos and documenting my journey, and like going back and watching my videos. Like, it's so cool to just like see like where I've come and like how different I am and how I look at things and stuff like that. So it's been awesome, and I'm so happy that all of you are following me. I have, I don't know, 50 something subscribers now, which is crazy. Like, I didn't think anybody would ever want to follow me. So I appreciate you all so much. If you're new, welcome, and you know, be sure to tell people about me. And yeah, so I'll see you guys in the next video. Make sure to subscribe below. I love you guys, and bye. Have a great day.